Have you walked into a doctor's appointment and realized halfway through that you forgot your list of symptoms, your questions, or maybe even your insurance card? Or maybe you left feeling like your questions weren't answered. It's not because you didn't care. Most people don't prepare for a doctor's visit like they would an important meeting. Most people walk into the doctor's office unprepared, and this can lead to longer visits, higher bills, and sometimes unnecessary tests. But here's the truth: if you're prepared right away, this can make your doctor's appointment faster, cheaper, and more effective. Think of it as showing up for a meeting. You wouldn't walk into a job interview or business presentation without notes, right? Your doctor's visit is no different. A little prep goes a long way. In this module, I'll show you exactly how to get ready for your doctor's appointment so you can get clear answers, better care, and zero surprises. All right, so we have a packed agenda for this module. The first thing is to know your goal. Then gather the essentials, do a quick insurance check. Next, write down your questions. And then timing matters. Organize your health story, an example, the 10-minute turnaround, and closing and next step. So, have you ever gone to the doctor and explained your symptoms and realize halfway through that you weren't even sure what you wanted out of the visit? Or maybe you just wanted reassurance, but ended up with a prescription or referral you didn't expect. That happens all the time because most people walk in without a clear goal. So before you even step into the office, decide why you're going. Ask yourself, what do I want out of this visit? Your answer changes the conversation. So, are you looking for a diagnosis for new symptoms, prescription refill or adjustment, alternatives first, like lifestyle, physical therapy, or diet changes, follow up on previous care? So, having a clear goal keeps the visit focused and helps your doctor prioritize what matters to you. Let's just say you have a knee pain, and if your goal is fast pain relief, medication might be suggested. If your goal is to avoid meds, the focus shifts, stretching, braces, or even therapy may be offered. The same symptom, but a different plan of action. Primary care visits are often brief, and going in with a clear goal helps you use that time well. Have you been stuck waiting at the clinic because you forgot your insurance card, your medication list, or test results? Maybe you had to repeat something because the office didn't have the information. That's one of the easiest problems to fix and one of the biggest time savers as well. So, the most common cause of delays isn't the doctor, it's missing information, as I said. Bring what the team needs to help you, such as your insurance card, an ID, medication lists, which include prescriptions, over the counter meds, even vitamins and supplements, with doses and timings. Also, symptom notes: when it started, how often, what helps, what worsens it, how it affects your day. Recent test results, discharge papers, especially if this is a follow up or if you recently were in the urgent care or ER. For example, Maria had a recurrent headache. She brought up the symptom log showing timing, fluids, sleep, and her doctor spotted a pattern of dehydration. And this ultimately avoided unnecessary imaging referrals. So, as a pro tip, keep a small folder, a secure note, or something on your phone that helps you gather this information, whether that's a picture of your insurance card, picture of your updated medication list, or your symptoms notes. Just keep it in your phone. That can help a lot. Have you ever gotten a surprise bill after what you thought was a simple checkup? Or maybe you found out later that your lab or imaging center wasn't in network. A quick insurance check before the visit can prevent all of that. So, one of the easiest ways to avoid surprise bills is to confirm coverage before you go in. So, ask your insurance company, is my doctor in network? Check your insurance website or apps. Typically, they'll have like a list of doctors that you can search in a specific area to see if they're in network or out of network. Does this plan cover the service I'm asking about? Some preventative service are free in network. Diagnosis tests may have a cost share. So just being up to date in your knowledge of your plan. Also, will your lab or imaging be billed separately? Samples are sometimes sent to outside labs that might be out of network. And I actually worked in a out of network toxicology lab, and so we would get samples from maybe a orthopedic doctor, and the patient will call us thinking that, oh, my doctor's in network, but I would have to explain we are out of network, and so they will have to pay us because we're out of network, and it kind of surprised them. So just double checking that will help. And a pro tip, just call the number on your insurance card, just to confirm the in network status. So here's an example. Ben had blood work at his physical. The lab was out of network and he got a $300 bill. Before his next visit, he asked the clinic to use an in network lab. Problem solved. Out of network bills still happen, especially for ancillary providers, labs, imaging, anesthesia. A quick pre check prevents most surprises. Now, have you ever left the office thinking, I forgot what to ask? This happened a lot of times, right? It's not that you didn't care, it's just because the appointment moves fast and it's easy to lose track of time. That's why writing down questions ahead of time is one of the smartest things you could do. So, here's what you can do to write down to make sure you don't forget the questions that will help you in the visit, right? So, I would suggest 3 to 5 questions, right, when you go to your visit. Now, here's some of the questions you can ask. Is this test really necessary now, or can it wait? Are there generic or lower cost medication options? What lifestyle changes could help before trying medication? Can I manage this myself, or do I need a specialist? What should I track at home? And when should I call? Pro tip: if you like to record instructions, ask first if that's allowed in clinic. This helps, right? The doctor's talking fast, the visit goes quick, and so if you can even record them talking, if they're okay with it, certain states have different laws on recording and things, but just ask and see if it's possible, and this will save you a lot of time and energy. Now, here's an example. Lisa had a stomach pain and brought up 3 questions to her doctor. Her doctor realized 2 issues were overlapping and adjusted diet and monitoring instead of ordering another scan. Writing questions isn't being difficult, it's being clear. You're paying attention to your care when you do this, but you're also paying for information, make sure you leave with it, right? You're ultimately the one paying for the service. Have you ever waited 15 minutes or 30 minutes or even eh, past an hour for your appointment time only to spend a few minutes with your doctor? Sometimes that's not bad luck, it's just timing. So, timing matters. Timing influences the wait and face time. So, here's some tips. You can book first thing in the morning or first thing after lunch when schedules are more likely to be on time. Avoid late afternoons if you can. Delays tend to accumulate. If it's complex, tell the office when you book, ask for a longer slot available. And a pro tip, if your clinic offers express or brief visits for straightforward issues, that can reduce waiting times. So, for the last one, the complexity, this what kind of push back times in clinics is the complexity, right? Some people don't go to the doctor for years and then they show up to the doctor when things are bad and they have a whole list of things wrong with them. So it may extend the timing of the clinic operations. So just making sure that if your visit is going to be quick, look for first thing in the morning, after lunch, so you can be on time and not spend so much time in the doctor's office when you don't have to. Now, here's an example. Derek used to book at 4 p.m. and waited an hour. He switched to 8:15 a.m. and he was usually out of there before 9. A smart schedule means less waiting, less stress, and more quality face time. It's hard at times because, some people work, some people have to care for others. These are suggestions that will help you save time and energy. Have you ever felt like your doctor was trying to piece together your medical history on the spot? When that happens, decisions could take longer and some important details can get missed. So, giving your clinicians the key facts up front helps them make it faster and safer choices for you. All right, so organize your health history. Give your clinicians the heads up front. Things such as major diagnoses or surgeries, allergies and reactions, current meds and doses, including supplements, vitamins, different things, relevant family history, early heart disease, certain cancers. This all helps the clinician piece together your what's happening in your body when you give them the symptoms. And so here's a pro tip. Keep a single one-page summary, either paper or digital, and update it twice a year. So here's an example. Carlos shared a family history of early heart disease. His new doctor ordered earlier screening, catching the problem before it worsened. When your doctor understands your background, he or she can make decisions that are safer and faster. All right, so let's bring it all together. Think back to your last appointment. How many of these steps did you actually take? Even one or two can make a huge difference. So, pro tip roundup. Number one, set a clear goal for your visit. Number two, bring your insurance card, your med list, and notes. Number three, confirm coverage, in network provider, labs, avoid out of network providers, labs, things like that. That can significantly increase the chances of surprise billing. Four, bring 3 to 5 written questions so you don't forget during your visit. 5, schedule smart early morning or after lunch appointments. And 6, keep a one-page health summary on deck, on your phone, a paper, Keep it in your glove compartment if it's paper, so you can be ready when you go to the office. Now, a few minutes of prep turns a rushed appointment into a productive one. Ever wonder if all this prep really makes a difference? Let's look at how a few small steps completely change one patient's experience. Example, the 10-minute turnaround. Amber walked in unprepared, forgot her med list, and left uncertain. After she wrote her goals, do I need an MRI or can exercise help? Brought a symptom log and updated med list. Confirmed her doctor and labs were in network and had 3 questions written down. The result, a shorter visit, and it felt focused. She avoided unnecessary scans and left with a clear plan. Now, prep doesn't just save time, it saves money and stress. So, how do you usually prepare for a doctor's visit? Imagine how different it would feel walking in organized, confident, and ready with your key points. So, closing and next module. Preparation changes everything. You walk out confident, spending less time waiting, and get better results. And you walk out knowing what comes next. So, in the next module, we'll cover the exact questions to ask during the visit, the ones that save time, prevent unnecessary tests, and help you understand your care. Preparation gets you in the door, but asking the right questions keeps you in control. I will see you in the next module.